Thank you, Peter. So Peter's given you a very good and thorough summary of the background to Chow. I joined Shooting Star Chase at the end of 2012, so I'm one of the people that came into to the organisation of Chow after its formation. One of the challenges we've had is actually deciding, out of the whole myriad of opportunities, what are we going to do as an organisation? So we've come up with 3 current strategic objectives. We will review them, but I suspect they'll remain broadly similar. The first one is about raising awareness and indeed funds of Chow and our member hospices by engaging with stakeholders. So that's around engaging with commissioners, looking for income generation opportunities, and engaging in some of the myriad of networks that exist in the health and social care environment. The second of the objectives is very much around education and training, both for people working within the member hospices of Chow, but also in the wider environment as well. And I'll come back to some of the successes on that front in a minute. The third objective is very much about looking to develop the services for children and young people and their families, the core work of the member hospices, and seeing how, working through Chow, we can actually extend the services which are there for the children and young people and their families that all the member hospices are there to support. I'm just going to flick forward one slide before I talk about some of the achievements, some of the lessons, and we'll also have Peter talking at the end about some of our future plans. Operationally, how do we work? Well, as Peter said, we have directors from each of the member hospices of Chow, which is the chief exec. We meet 4 or 5 times a year. We've got an away day for 24 hours in December. But we also have working groups below that. We have a learning development group, the directors of care, stroke register managers, finance and fundraisers. We've also done a couple of one-day workshops with our senior teams. So we have a structure below the directors of the group. So what have we actually achieved as Chow? As Peter said, one of the first achievements which actually undertook before my time was the learning and development strategy that Kent University did, but that is something that we have come back to, and I think we'll continue to come back to as an important piece of work. There is a programme of joint induction between members of Chow. Now, one of the things that I think is important in our form of collaboration is not everyone has to do everything. So actually, my own hospice doesn't get involved in the joint induction programme, partly for geography and partly because of a question of scale. We have a sort of quite developed induction programme for ourselves. So there's a flexibility to Chow, which I think is one of its strengths. You don't have to do everything if it doesn't quite fit your organisation. There's also been joint bereavement training, again for people working within the member hospices. We had a very interesting report done, getting on for 2 years ago, about how we could move forward as an organisation. I think the biggest successes have been in the next 2 areas. We obtained some NHS funding to do GP training around working with children with palliative care needs. And we had over 100 GPs who participated in that training. It was accredited, so they got the right outcomes from their point of view professionally, as well as we hope clinically. It was very well evaluated and received by our GPs. We also participated working with Great Ormond Street, so another form of collaboration with some training for nurses as well. They led on that, but we were involved, and we had 180 nurses who were also trained in issues around children's palliative care. So that ticks one of the boxes on the education and training side. I think in a more informal way, what we've also started to see is people piggybacking on each other's training activities. We do a number of care study days at Shooting Star Chase, and we had people coming from the other hospices who've come to some of those. We're looking at developing some accredited training for healthcare assistants working in children's hospices. And again, there's an interest in working on that together. So I think once you set the mechanism and set the structure, other forms of more informal collaboration can come out of that. But probably the biggest success is the corporate partnership we've had with BlackRock. And to me, this is a great example of what would not have happened if we'd stuck as independent organisations, maybe speaking to each other but not working collaboratively. We were adopted by BlackRock, who are a big city finance house, as their charity of the year. They adopt a cause across London. As they said to us, There's no way we'd have chosen one of you, but we love the idea of working with all of you. So that partnership's coming to an end shortly. I think we aim to raise £500,000. So far, we've raised just over £700,000. And that is all money that would not have come to the members of Chow if Chow had not been in existence. There's been challenges on that, which I'll come back to, but that has been a major achievement. And certainly for those in our fundraising teams, there's nothing like having some hard cash to be able to show the merit of such an organisation as Chow. But also, and I think Peter's reflected this, Shaun's reflected on it, having a common appetite and enthusiasm to collaborate. I remember some years ago, Ros Taylor saying at one of these events, it used to be a risk to collaborate, now it's a risk not to collaborate. And that's a phrase I quite like to remember, because I think it says a lot about the world we work in today. There have been a lot of lessons in what we do. As Peter reflected, actually, the member hospices from Chow are very different in terms of size, age, scope and scale, and that has proved challenges. There's been different levels of appetite. I've had people within our hospice saying, why aren't we getting roughly half the money because we serve roughly half of London? And I said, well, that's not quite how collaboration partnership works in practice. You know, we're trying to look at the bigger picture here. What else can we achieve, not only for us, but for all the children and young people across London? As Peter said, and he had the patience to see it through, the development of Chow actually took a long, long time. And I'll be honest, in the first year or so I was involved, I was beginning to say, well, where is this going? But as we'll come back to in a minute, I think there's been some positive developments which have helped us take forward in terms of how we manage Chow. And one of those is, I think, about 2 years ago, we actually employed, we say administrative support there. We had administrative support from one of the hospice members, but we had someone who came in and really had the background and expertise to make things happen. Trying to make things happen from chief execs already very busy on their day job, to me, is a big, big challenge. Actually having some dedicated resource that could come in and drive projects and activities. It's someone who used to be a chief exec of a membership organisation himself, which probably helped in terms of his experience of collaboration. But to me, that was a major step forward for the organisation. We have had to fund the organisation, as you can see, although this year we haven't put our annual subscription in yet because of the surplus funds that we've generated from the BlackRock partnership, but we're committed to putting finance in if we're going to make the organisation work. I think another lesson I'd say from the BlackRock partnership, we actually got some interesting feedback from people at BlackRock about, in practice, operating one partnership, but with 5 different hospices had some challenges. And I think we as directors perhaps underestimated that at the start. Actually organising the fundraising activities, even with a dedicated lead from one of the hospices as the sort of account manager, proved quite troublesome, but we learnt some very important lessons there. We've also had approach actually very recently from a charitable foundation who actually support at least 2 of the member hospices of Chow who are interested in supporting Chow. And I think that's another source of revenue and support going forward, not just on the corporate side, but the foundation side. And I think it's actually very positive that members of Chow have felt able to respond to that without worrying too much about their ongoing support from that organisation. Also, as you say on there, important to keep not only chairs and trustees, but also senior management teams in the loop of what you're trying to do. So I think there's a whole lot of lessons that we've had, as well as the achievements. So we're very much looking forward to how Chow will go forward. And that's the signal for me to hand back to Peter to finish things off. Thank you.
Thanks very much, David. I'll just be 1 minute. I hope we're still on time there, Mr. Chairman. Quickly get my notes. Yes, the things that we get, the BlackRock money that's come through, we are going to retain around 100,000 of that to support the work of Chow for the near future so that we can start getting some work off the ground. We're looking at how using that money, and this is where we're getting the support of our senior teams to come in to help us shape up what those things should be, particularly around how we can develop some new, probably innovative care delivery across London. One of the examples could be neonates, and the study that was done, that was funded by the money from the Department of Health, indicated that neonates are that's an area that there is not much attention given from a children's palliative care perspective. So there's something we can do there. And of course, we'd need to do that in partnership with colleagues in the NHS and other organisations. The BlackRock partnership has given us, we hope, some terrific leverage now into some new partnerships with other corporate organisations. And David has already mentioned as well, a trust and foundation that's looking to help us funding as well. We're going to have an away day, David already mentioned that as well, in December, where we're bringing together this thinking after we had a day with our senior staff to think about what the next steps should be. And I'm pleased to say right at the end that we're having positive discussions with Demelza House that hopefully they're now going to come and join us if we can get that agreement right between the six of us. I think coming back to the beginning though, why we're here in the first place, children, young people and families, how can we reach more and how can we do it better together? We've started that journey really. It's taken quite a long time to get to this point and we've got a long way to go. Thank you very much.
Thank you very much. Questions or comments?
Hi, I'm Shifra from Northern Ireland Hospice. I come from a fundraising background and I'm just interested in the last presentation and how important you think it is to have the case for support first. I mean, I think the BlackRock funding may have been unrestricted to some element, but how important do you think it is for people starting off on this direction to actually have a clear benefit for families and children before you would go to the funder? And then secondly, if you were doing this again, how would you do it differently?
Thanks, Shifra. Is that okay, Peter? I think that's a very good question. And yes, the BlackRock money was unrestricted, which was great. They were very taken by the fact that we were working together as children's hospices. Obviously, part of the presentation was a broad overview of our care. We have put another corporate bid in, which we got very close to, but didn't succeed, ironically partly because we already had a partnership with a big finance house, which was around, I think it was around transition as a particular project. I think, to be honest, the case for support in terms of detailed programs for particular activities, rather than a more general case for support for chow in the broadest sense, is something that we do need to do some work on. And it's part of what we'll be discussing on this away day. So we can come up, with the case for support, the rationale that we can then go and look for the funders, particularly, I think, on the charitable trust foundation side. So I think in retrospect, that's probably something we might have done slightly earlier in the journey. I mean, some of you may have been at the session yesterday when the North Wales hospices were talking about the work they've done, and they've commissioned a case for support now, and I've spoken to the chief exec from one of those hospices. So I think that is something we do need to work on in terms of taking chow forward to the next step.
And can I just to add to that, one of the things that BlackRock were concerned about and didn't feel they were getting enough of was engagement across all the 5 children's hospices, because it was being led by one, and naturally a lot of the attention was, from the staff's point of view and the corporate, was coming into that particular hospice. So we had to work quite hard to get that engagement across. And one of the things we should have done at the beginning was ensure that we understood the expectations of the corporate, even though it was unrestricted funding, so that we understood at director level what was expected from the corporate.
Antonio.
How much did you take a planned and coordinated approach to how you worked with and got the support and buy-in of your different boards of trustees? And how much similarity and difference was there in the way that the different boards responded or were willing to engage or enthusiastic or concerned about being involved in chow?
As I said at the beginning, we spent considerable time bringing the chairs and the chief execs together to ensure that we got buy-in at the very beginning from the chair of each of those boards, and at the time those chairs would go back and have individual discussions with their own board of trustees to see that everyone's agreed in principle, and then they would feed back in to the main group for Chow that was forming at the time, that was incredibly important because we need that buy-in from the boards and the chairs in particular. What we've tried to do annually, and we haven't done it this year yet, and we're trying to get a date arranged, is to then have kind of also like a summit meeting, so we bring the chairs back together again, and we've suggested as well that they might want to bring some trustees with them. Inevitably, it's very, very difficult to find a good time slot to enable people to do that, so we'll probably have to find some time out of normal working hours for that to happen, but it's incredibly important if this is going to really have substance and credibility for the long term.
Hello, I'm David Houston, the Chief Executive at Trinity Hospice and Brown House Children's Hospice up in Blackpool. I'm interested in your thoughts on managing staff and local supporters' anxieties and expectations around this developing behind the scenes, as it were, body. I think most of us could probably speculate as to what other areas of perhaps collaboration you might be debating at the moment, and our staff aren't stupid either, so could you just tell me a little bit about how that's panning out, if you feel comfortable to do so?
I think we should both say something about that because we'll have different views because of our own organisation's response. The important thing, I think, has been initially getting the chief execs on board with this, obviously, and then for us to then sell it into our senior team because they were going to be probably quite instrumental in helping us take this forward in the first instance. If you were to go to a member of staff across one of your organisations and you mentioned Chow, they might say, probably heard about that, I'm not quite sure what it does. So we've got some work to do there. But I think one of the advantages we had with the joint induction programme with staff, so for new staff coming into our respective organisations, we do this every other month. We have this joint induction programme. There's one on Monday and Tuesday this coming week. And they come together and spend 2 days together. So you'll get that mixing of staff, new staff from each of the hospices coming together. That's been very powerful. And there's always a very positive feedback from that. So that's just one way of getting that buy-in, but of course it's for new staff, not existing. So I know in my own organisation, inevitably being the chair of this and being quite passionate about the whole thing, we spend a bit of time talking to staff through various medias internally about what Chow's doing, what we're trying to achieve. But of course, unless they're actually engaged with it and doing something themselves, then it probably says, that's very good, Peter, and how can we get back to the day job? So there's a way to go. David?
I think the only thing I'd add is we haven't really had any feedback, if you like, in terms of local supporters. I mean, frankly, this is much more of a London-wide project, I think, on a more strategic level. As I said earlier, it's within the senior team at Shooting Star Chase, there's been some concern or some desire to actually understand and see what the benefits are. And I think one of the challenges, as I said earlier, has been about the sheer range of activities you could do, and actually one of our major steps forward was when we prioritised some. And I think the corporate partnership and the training that we did with GPs to actually prove some evidence and results has gone a long way to reassure people that this collaboration has some legs in it. Clearly, although it hasn't come up in discussions at my end, partly because we had a merger ourselves 3 or 4 years ago, so I don't think there's an expectation that there'll be anything more formal. Now, clearly there are other possibilities of working together in different ways. But as I said earlier, not every member of Chow has to do everything that's on the menu. And that reflects a different size and scale of the organisations. So I think that's a positive element in that there's that flexibility to it as well.
And just to add to that around local supporters, I think one of the things I've always been very conscious of, and we've had the discussion, I think, internally around this, is that whilst you've got this new organisation with its own brand and its own way of doing things, what you mustn't lose is your local brand and identity and support, because we've all spent years building that up. So the trick to be played is to get the economies of scale behind the scene in the way that David's been describing, but then keep the front end the same, broadly speaking, so that you still have that buy-in from your supporters, because you have local ownership from your community, and that's a real strength. So this is a way of keeping that strength, I hope, but getting the economies of scale behind the scene.
Thank you. Going to draw those questions to a close now, because we do want to hear from Mark as well, but I'm sure if you have any other questions, Peter and David will be only too pleased to hear them. So we welcome to the podium Mark.
Good afternoon. I think it's really important at the start of any presentation to manage expectations and to avoid hyperbole. So in that spirit, I'm very pleased and delighted to have the opportunity to talk to you today about the most exciting, the fastest moving, the largest scale joint commercial venture in the history of the UK hospice movement. The Hospice Quality Partnership has just been running for a year. As the slide says, I'm the chair of the Hospice Quality Partnership, but I'm talking to you today as Chief Executive of St Helena Hospice, because that's my job first and foremost, and I wouldn't be spending time and effort on HQP if I didn't passionately believe that this was in the best interests of my local hospice. And I'm just going to tell you a little bit about our journey to date as an organisation, where we are at the moment in terms of some of the opportunities, and then a call to action. And I'm hoping by the end of this session that you'll all be rushing down to stand 8 to get your information pack and to talk to Tracy and Liz about how you get joined up if you haven't already. So the starting point, very similar drivers to what Peter and David were just talking about in terms of CHAL. We all know, and it's been brilliantly articulated by the Marie Curie Commission report from the London School of Economics, that there is 100,000 people per year with palliative and end-of-life care needs not having those needs met currently. And it's a fair bet to say that the vast majority of those, that therefore means that their families and carers are not getting appropriate support as well. And what's even worse is within that 100,000 figure, there is a huge amount of inequality of access to palliative and end-of-life care in this country. If you're over 85, if you live in a deprived area, or you're from a black, Asian or minority ethnic background, then you are far less likely to get access to hospice and palliative care. And we face that challenge in the context of ever-growing demand for our services, and the picture is there to illustrate a shrinking pool of resources for us to work from to deliver that. Hospice UK have just done a really good piece of work through the regions of asking members for feedback about their top priorities, and sustainability was right up there. Sustainability in terms of voluntary income and sustainability in terms of commissioned income. And I think it's fair to say that hospices have never had to work harder to raise every pound of their own income, and have never had to jump through so many hoops and so much regulation to earn every pound of income that we get from the statutory sector, and bearing in mind that we only get a modest minority proportion of our funding from that source. So that's the driver for getting involved. A number of hospices, particularly those in the northwest, but myself from Essex got involved very early on, started to explore what we could do together to try and address in part this issue. And we drew upon experience from other sectors and also from other countries, particularly a Premier Incorporated, which is a social enterprise organisation, massive one in the States, which is not-for-profit hospices and hospitals, very large business now, and which is about hospices working together in terms of economies of scale, added value, and sharing information and benchmarking. So we knew that this has been done before. We knew that there was lessons that we could learn and take from other sectors, and we worked together as a group of hospices over about 18 months just to test the feasibility before we then created the company. And it was this time last year, I think it was 8 o'clock in the morning on the Wednesday in Leeds, that those brave souls that were particularly visionary or were quite tired from the night before and had stumbled into the wrong room, heard about the launch of the Hospice Quality Partnership. And what we were presenting was a very simple proposition, that this is a company owned by the hospices that it serves. It's very much a commercial for-profit social enterprise, so it's a different way of helping deliver our charitable objects. And it's all about reducing cost from economies of scale, from procurement advice and support, but also about some of those hidden costs that we all spend time and effort in terms of our procurement, and there are opportunities if we do it together to actually streamline that. We also wanted to drive improvements in quality. We felt passionately that benchmarking was important and that we could learn more from each other, particularly in relation to understanding variation in expenditure and value for money. And we also feel strongly that there are lots of opportunities in the future for generating income together. Our vision is a very straightforward one. This is all about maximising value in whatever form that takes for hospices. And as I say, this is a commercial means to an end. So it's not about the profit, it's about the opportunity to reinvest that in patient and family care. And we're a year later now, and I think we're doing okay, actually. We've got 48. I think we've got a couple in the pipeline, so I think we're fair to say we're probably technically at 51 now, and growing all the time in terms of hospice partners from right the way across the UK. And I'm pleased that just in the last couple of days as well, we've now got invitations to visit Northern Ireland and Scotland, so we soon hope to have hospices represented in those parts of the United Kingdom as well. And I think it's important that actually we've been particularly successful in recruiting hospices with larger expenditure. So we've already got 22% market share of the hospice sector, which is really important for our engagement with suppliers and potential partners. And those hospices so far give us a combined expenditure of just over £240 million per year. And we've got 3 agreements that have either just gone live or about to go live, and information will be going out to our partners this month. The first is on online mandatory training licenses, where we've managed to negotiate a 25% discount from IASCO, a very well-renowned supplier. We also have an agreement for catering equipment and supplies, where we've negotiated in the region of an average 10% saving for hospices. And the first one to go live is for paper and stationery with a company called Lyrico, where again we've negotiated a 10% saving. Now, paper and stationery, I appreciate, is not the most exciting subject when we're talking about hospice care. But I think the fact that with our existing partners, if we all switch to this new supplier, we can collectively save £180,000 to reinvest in hospice care. That just gives you a flavour of the potential as we move on to delivering value in other areas. We've also got the first reports just going out to our partners at the moment, where we've got unique spend analysis and benchmarking data that's not been accessible before, and that information is only going to get better as more hospices join and submit their data. We've been working hard on a number of strategic partnerships, particularly working with similar collaborative organisations from other sectors, linking in with a number of social enterprises from across the country. And we've also been working very closely with Hospice UK, and we've been really grateful for the support from the whole of the executive team who've been involved right the way from the start of the project. And I'm also really pleased that, really great timing, literally today I have some breaking news to share, which is that we've been in a competitive process with 200 other social enterprises from across the UK to secure investment and support from Big Issue Invest, which is one of the largest social investment organisations in the UK, well known obviously for the Big Issue work with the homeless, but is also a partnership with massive companies like Barclays, Experience, and Places for People. And we're delighted that we've been successful in that very competitive process in securing investment into HQP, which is going to allow us to further increase the momentum and the pace of the work that we're doing, and is also offering us a long-term relationship and mentoring support from a number of other existing private and social enterprise organisations as well. So I'm really pleased that I can share that with you today. This is the point where I hope you're looking at that map and you're saying, if my hospice is not a member of HQP, why am I not on it? And I hope you'll see that we've got a great range of different types of hospice, children's and adults, from right the way across England and Wales. And as I say, we're hoping to get into Northern Ireland and Scotland soon. It's really easy, if you haven't joined already, to get your hospice logo up on that map. All you need to do is submit a £10 share application, and we're a company limited by shares, one hospice, one share, so very straightforward. So your maximum liability as a shareholder should, as I don't think it will, it fail at some point in the future, your exit strategy is that you lose your £10 shareholding. So I think that's a fairly modest risk in the context of the potential gains we're talking about. And then the only other thing you need to do is pay a very modest annual partnership fee of £1,250. And you don't need to delay. You can sign up today because we will only charge you pro rata for the remaining months of the year. So that's a pretty good deal, and I think a pretty low level of risk to get your name up on that map. Now, this is a really exciting slide, and I'm so grateful that we're in this ridiculously big hall because you can actually see the numbers on the ridiculous screen behind me. So the point of this screen is to link the potential from HQP back to the reason that we created the organisation in the first place. So Hospice UK, working with a number of other national charities as part of the Ambitions partnership, have been lobbying the government to respond positively to the recommendations of the Health Select Committee review into choice in end-of-life care. And they've been calculating and lobbying to say that the government needs to get another £130 million into the sector per annum in order to deliver those recommendations. Now, of course, we hope, and we can all cross our fingers, sit on our hands and wait for the spending review that's forthcoming and see what happens. What this slide is telling us is that we can already deliver 10% of that gap by changing our behaviour and by collaborating and working together. So these are the top 7 areas of non-pay expenditure in hospices. So we've worked with our partners and we've used nationally available data to do this analysis, and you probably won't be surprised by the categories up there. And we've worked out what the total expenditure is in the sector, and it's the column on the right-hand side in red that's the one particularly to focus on, particularly the total column at the bottom, which says that we're spending £145 million a year across the 225 UK hospices on those 7 items. Now, Hospice UK already has 3 frameworks ready to go, and by the end of this financial year, we will have a framework offer in place for every single one of those top 7 areas of expenditure. And if every hospice in the country were to join, and if every hospice in the country were to keep buying the things that they're already buying at the same or better quality and with a lot less time, effort and risk internally, because you don't have to worry about managing the tender process yourself, you don't have to worry about doing credit checks on your suppliers, and I do wonder how many of us actually do credit checks on the large number of suppliers that we all have to manage. All of that will be done as part of the tender process that HQP is managing, and all you have to do is buy those things you're already buying at a cheaper price, and we've released circa £10 million recurrently every single year to help us close that gap to address unmet need and reduce inequality. It's that simple. If that doesn't persuade you, I'll be disappointed. There's also the value in benchmarking your data. So the other way of looking at hospice quality partnership is a charter mark. It's an opportunity for you to assure yourself, your senior management team, your board, your commissioners, your donors, that you are a responsible, cost-effective organisation that has taken the time, the effort and the trouble to make sure that every pound that you're raising, you're spending in the most effective way possible. So even if you just join us, you pay your £10, you pay your £1,250 a year, and you work out that actually you're at the extreme end of the scale and you're the hospice that's getting the best deals currently, you will at least be able to evidence that. I think it's highly unlikely that you're going to be doing really well in every single one of those categories, maybe in 1 or 2. So although those savings may not fall equally, I think the least that this will provide to you is a really good evidence base for you to assure all those stakeholders that you're getting good value. And as I say, as we get richer data, as we get more data, as we continue to grow and develop, it's really going to help you with identifying your priorities and identifying where there's opportunities to learn from different practices and different approaches in different hospices. I think this slide's particularly powerful. One of the things we've been doing as we've gone through those sort of top 7 areas of expenditure is that we've been looking at some sample products. We call it baskets of products. Within the stationery and paper, we looked at just one common item of sort of stationary equipment. And we looked at the variation currently within our partner hospices. So at the moment, you've got Hospice A paying £1.75. You've got Hospice B paying £5.99 for exactly the same thing. And you've got Hospice C paying £8.70 for exactly the same thing. And what we can do, if we work together and if we buy into the frameworks that are now on offer, is we can make sure that Hospice A, B and C are all paying £1.75. And that's an 80% opportunity for Hospice C. So I hope that really sort of helps make the point that there is a huge amount of variation currently, which is not justified in any added value or quality. Now, just coming back to that initial figure, and this is I'm starting modest because actually, you know, the other slide, there's a £10 million potential here. But even that 180,000, just on everybody switching currently who belong to HQP, that's 6 palliative care nurses funded for a year. It's 135 days of running our single point 24/7 palliative care coordination centre, which includes a rapid response service. It's 7,000 plus hospice at home visits and 7,500 family support worker sessions for families and children. It's a huge potential opportunity just by us changing our behaviour and working together in a concerted way. This is my sort of final slide, and I suppose this is the sort of call to action. You know, collaboration is not collaboration if there is not shared risk and shared gain. Our traditional forms of sharing learning and information and being polite and nice to each other, that's all very cosy and comfortable. But does it really cut it in the context of the levels of demand that we face? Does it really cut it in the increasingly challenging and difficult conversations that we have with donors, sponsors, commissioners and regulators? You know, we've really got to rethink some of our approaches if we want to make a difference and if we truly want to make sure that we eradicate unmet need and inequality of care in our country. And the way that we need to do this is you need to get involved, you need to be a partner of HQP. As I say, it's really easy to do, and actually you can sign up as soon as this session's finished if you like. Go down to stand 8 and we'll show you how. I'd urge you to do that as soon as possible. Once you have joined up, that's not it. You then need to work with us to change behaviour in your organisation. So you need to look offer by offer, check whether it works for you, because in some cases it may not, and a bit like Charles, you're not obliged to do anything that you don't want to, but we're very confident that for at least some of them, you will want to buy from our frameworks. Once you've identified those that are going to be of benefit to you, make sure you switch your behaviour, make sure that you persuade people in your organisation that are actually putting the orders in and signing the invoices, make sure that they're using the HQP frameworks, because that's the way that will make sure the return comes back into the hospice sector. And start doing that as soon as possible, because what we're doing in the short term is we want to get these deals on the table for you to access as soon as possible, because there's an obvious quick win to be delivered. What that means is that we're trying to get the best deals possible as quick as possible, and we're entering in the first instance into short-term deals. Because what we want to get is applying the 80-20 principle. We want to get the 80% quick win as soon as possible, and then in a year or 2 years' time, we will revisit, retest the market, and we will then be able to offer further opportunities. But the more people that start buying now, the stronger the evidence, the more leverage that we have in our future negotiations with suppliers, and we will then continue to deliver ever better value to all of you. And we recognise that will be tricky, so you do need to do some culture change, some similar issues to any form of collaborative working, but we will be providing outline presentations and toolkits to help you build an understanding within your organisation, not just at a board and executive level, but also those that are actually the ones that are placing the orders so they understand what the potential is. And as I say, at the moment we're just talking about procurement. That's only the first phase of what we hope to do, but the potential there is enormous, and we know if we can get that right and we can start delivering some returns to the sector, we can work with all of you collaboratively to start looking at those income generation opportunities where we're stronger together. Thank you.
Thank you, Mark. We've got time for just 2 or 3 questions for Mark.
Steve Dewar, thanks very much. It's actually a question for the whole panel, if that's okay. Slightly different type of question, but I wondered what how the panel might respond if commissioners, particularly out in the world of the NHS and social care, were to come and request a new partnership in order to develop an accountable care organisation for end-of-life care.
Thank you. Shaun, do you want to go first?
I think we'd welcome the opportunity to have the discussion, whatever that entailed. But I mean, when I was thinking about the examples to give from St Christopher's perspective, I did wonder about, I suppose, majoring at least some of them on a commissioning relationship. But I mean, they featured in the care coordination service, but actually probably no more than the local hospital and local GPs do. But I think, if I understand your question right, are we open to having those conversations about a different kind of partnership with social care? Is that what you were saying, as well as healthcare? Was that the point of your question?
Well, I think if we look at some of the new kind of vanguard sites who are developing kind of integrated care organisations for management of long-term conditions, then quite often there are many delivery partners, private sector as well as public and voluntary, kind of being pulled together into one organisation, virtual or real.
Well, we just only about 3 weeks ago were one agency signatory on a 10 agency bid for £500,000 to scale up the work of one of our services, and I think that's going to be how it is in the future, and that forced us to have conversations with people that we don't normally talk to, which is very useful. I think it's interesting that of the 10 different signatories, of which we were the one, despite having all of those conversations as early as we could and getting buy-in with the concept and everybody feeling that they had a stake to play in the overall delivery, on the final day of submission, with 12 hours to go, we were still chasing that final signature from the Acute Trust. And I suspect that's how it'll be.
One of the thanks, Steve, for that question. One of the key drivers for us was around how we could have a platform for London-wide commissioning, should that come through in whatever form it's going to come through, because as we know, it's constantly changing, and they're, doing things completely differently now as they were even a few years ago, and it will keep changing, I'm sure. So we wanted a platform through which we could use that to help us have a much wider, more substantive discussion with commissioners, and therefore, like Shaun, would welcome those opportunities as they come forward. And equally, between us, we have different experiences of our local commissioning landscape. Some of us are doing quite well, some of us are doing it in a more sort of ad hoc way, and so on and so forth. So again, how we can work together to learn how to build up our expertise and intelligence around commissioning, and how that could work for the future for us as well. And just one thing to add, Steve, I've noticed as we've gone round and talk about your own organisation, that's one thing. As soon as you mention that you've formed something formal for the whole of London, particularly people I think in statutory agencies are really interested that you're doing that and think it's the right thing to do, and therefore want to positively engage with you.
Thank you. Thank you very much for the questions and the input. I think there have been three very interesting and different presentations. I'd be very surprised, if not shocked, if there's anybody sitting in this room who isn't involved in some form of collaboration, hopefully one that's as challenging as it is necessary. I hope the questions and the thinking and discussions will go on, but I'm not going to go on. I'm going to ask you to show your appreciation for our speakers. Thank you.